I'm Samuel C. Evans, a doctor in the Philippines, serving in remote and inaccessible places indigenous people of the Philippines who are underserved.
Hi, my name is Darlene. I go by Dada. I work for REACH for almost 6 years now, and I'm a registered nurse.
I am Ayan Otbot, a liaison officer of REACH International. I have been with REACH for 5 years. My area is on that safety, scheduling, fixing the truck.
I am Jennifer Harrison, and my official title is fourth year medical student, soon to be a doctor of osteopathic medicine.
I am Jordan, Levi Buado, that's my full name, and I am a registered nurse, a staff of REACH International.
I'm Bernice Totor, and I'm a nurse, a registered nurse here in the Philippines. I am currently working as a staff for Dr. Sam in REACH International, and I'm just part of the team.
I'm Dr. Stu Harris, an internal medicine resident at Community Memorial Hospital in Ventura, California. I'm a recent graduate from Pacific Northwest University College of Osteopathic Medicine.
REACH International is based upon compassion for those who do not have what we have, and therefore we are trying to bring, through compassion, improve their health care both physically and spiritually, and help them access their own systems here in the Philippines, not just external help, but within their own country. How do they go about getting help?
My word to describe REACH would be compassionate. That's what seems to drive everyone, and myself included.
REACH is everywhere.
REACH is love because we love all people, we love all things.
It's a partnership between these communities who provide housing and food for the REACH team, and REACH, who provides medicine and sustainable training for these isolated communities in healthcare.
REACH is a teaching ministry and is a outreach programs towards the people which have limited access to healthcare. So we're able to reach out to them through our services rendered, which is healthcare, health teaching, and free medical services and surgery.
REACH Care International trains resource people or healthcare workers. This program is a 10-session program with one session a month, lasting a week. A typical week is we leave on Monday, we have 8 hours of lecture on Tuesday with surgery. We have then clinics with half the students on Wednesday and half the students on Thursday. A typical class will be 20 to 30 students.
So I think REACH is not only helping the people, but bridging them to the medical care that they're able to get by themselves because of its distance from the nearest hospital.
We do teaching, we do educate, but not only educate, but we still have this access with the people. So we go where the needs are.
They just need things, and sometimes it's just a shoulder to cry on, to be honest with you, and sometimes it's just reassurance because they don't know that it's okay. They don't know if something's benign or not. So REACH is just an organization that provides kind of a helping hand to people that are so far out there.
REACH International is mainly helping the remote areas. I just feel like we give a lot of care for them, and at times, like when you don't speak the language, they don't receive the medical care that they deserve. Your presence, our presence, or REACH presence in that area is enough for them to know that somebody cares for them.
REACH International is a ministry-based group that goes out into the most isolated areas of the Philippines that otherwise would not have health care, would not have access to medicines, and don't have the means to pay for it. And we provide free examinations, free surgeries, and free counseling.
REACH International needs support in a number of ways. We are trying to train, as my wife states, people to fish and not just feed them fish. And to do that, we need resources. We need prayers, moral support, we need financial support, and we need supplies, particularly medical supplies, sterile things, as well as medicines.
I can support REACH by sending donations like supplies, medical supplies, or monetary donations through our website.
Literally, REACH cannot go without finances. But I wanted people, if they wanted to help, I guess, prayers. Here in Mindanao, there's lots and lots of threat. And even though that we overcome that fear, you cannot still deny the fact that there's this threat.
Really help support REACH by being aware of its presence and possibly getting involved. And donations always help.
People can support REACH through your prayers. Please pray for more workers in the harvest field who has the same vision and mission as we do. Health teaching, primary health care. Please do support also REACH through financial if you can help.
People can really help REACH by volunteers. Through these people coming here in our country, they can see what we do, and that they can spread it to the people in their place, and they can really help build sponsors and reach out also.
So REACH International is a non-profit organization that thrives off of volunteering or even sending medical supplies. The word can get out through social networks like Facebook and Twitter, because you never know when that'll touch someone's heart and they'll get inspired and motivated like I was to either volunteer or to send a package of usable medical supplies or even to donate a few dollars, which in the Philippines goes very far.
I had this great desire to come to the Philippines because there was lack of health care in the rural areas. People traveled 3 days even to come to clinics. And so I came to the Philippines to address that need. Between 80 and 100 million people on the island of Mindanao. In the rural areas where I go, it may be 4 hours to the nearest hospital or doctor. Crucial to individual people who are missing out on many health advantages that we as Americans take much of this for granted. In fact, we consider it a right. However, that is not the case here in the Philippines. And so I'm here serving because I feel like that is what I should be doing in life as a purpose.
Well, I am doing, and I'm a part of REACH International because I feel like I am called to be a nurse in the outskirts, not in a four-cornered room, because I felt like I am best. I'm giving my best, and I'm used by God in the best way possible in this kind of setting.
REACH for me is a family and a ministry. How I love my family, that's how I love also REACH. That's why I'm doing this. It's not for my own sake, but also for my people around me. The people also here in Mindanao who can benefit this kind of ministry. I love my family, so I love REACH.
I'm doing this because I really care about people and I want everyone to have access to care and basic health needs. So.
It's because I care. I love working with people. And the first reason is God has really led me to do this job, this work.
For training, for this experience, since I've been here, I've encountered surgery, I've encountered family, primary care, medicine, I've encountered emergency medicine, I've encountered infectious disease, I've encountered OBGYN, and that's all in the course of 3 weeks. So it's a very good experience. You know, I'm able. I've received the medical training to where I can learn and I can provide. But also it's just always been on my heart to to help underserved people.
I do this because I love my job. I love the ministry. I love seeing people, that they are cared for and that they are my fellow Filipinos. I just think that when we go to areas and we serve the people, it's like we've done the best that we could. You know what Dr. Sam said, that we always give our best.